Important question. Let me first tell you about the benefit of angioplasty. As I mentioned earlier, during an acute heart attack, angioplasty is life-saving. It not only saves the life, it also reduces the further damage to the heart muscle as well. So timely done angioplasty is very important. If it's not a heart attack and patient is just presenting with the symptoms of angina or chest pain, then angioplasty relieves the symptoms of the patient. And also if there's decreased function of the heart muscle, where the heart muscles have become weaker, angioplasty restores the blood to the heart muscles, improves the contraction of the heart muscle, and also improves the symptoms and long-term survival. So these are the benefit of angioplasty, and also prevents the further heart attack in the near future as well. It doesn't completely elaborate but reduces the risk. As far as risk of angioplasty are concerned, like any other procedure, this has inherent risk as well. Risk we quote during angioplasty is just 1%. There's a 1% of risk of having a further heart attack requiring emergency bypass operation, stroke or hemorrhage. There are various types of stents available. There are drug-eluting stents, which are first generation, second generation and third generation. In fact, if given a choice, I would just use a third generation stent for all my patients. In fact, in that also there are various companies who have their own parameters, who their own platforms on which they develop stent. Stent is like a metal, as I said, and different companies have different diameter and thickness of that metal. Depending on the thickness of the metal, we choose a stent depending what type of lesion are we treating. For example, if the lesion or the blockage is very distal and the artery is very tortuous, you probably use a stent which is very thin struts which can travel very easily. If I'm doing a complex angioplasty where there's a branch coming up from the main artery and I have to use a design which is, it's a technical term, what we call as open cell and closed cell design, where I want the gap between the stent struts is larger, then I would use that particular stent so I can pass my wire through that stent struts into the branch as well. So it's all technical, but mostly a third generation stents are better for all the patients. These stents, the third generation stents, are better. In fact, they start quite longer. They last quite longer. But having said that, they are not without risk either. In fact, when we do a procedure, we do explain to the patient there's a 1% of risk of acute stent thrombosis. That means the blood gets clot within the stent and blocks the artery. The chances of 1%. Hence, after the angioplasty, we monitor the patient in the ICU for 24 hours. Then from 1 to 6 months, the risk of 5% of stents getting blocked again. From 6 months to 5 years, the risk is around 15 to 20%, and that increases if the patient has diabetes. Hence, the regular follow-up, also addressing the risk factors, taking the medication regularly is paramount. As I initially said, the angioplasty is ballooning and then putting a stent in. That is a simple angioplasty. But there's something more than simple, what is known as complex angioplasty. That is required, for example, if there's a lot of hardening of the artery, a calcium deposit, a simple ballooning and stent might not work, and we might have to break that calcium by a procedure known as rota ablation. It's like a drilling the artery as well. So that's one innovation that we very routinely use. Then sometimes we do an angiography, we see there's a lesion or there's a narrowing which is 70%, we are not sure whether this is really 70 or is this 80 or 60. Then there are innovations where we can do an IVUS, which is intravascular ultrasound. This is like a camera which goes into the artery and very accurately sizes the diameter of the artery, accurately gives a percentage of narrowing, so we can rightly either deploy or not deploy the stent in. Then another innovation which is known as FFR, that's a special wire which has a pressure sensor on it, which checks the blood flow within the artery as well. It gives a computerized indication whether we need to put a stent in or defer putting a stent in as well. And there's another new thing coming up, which I was fortunate, I had to use that device and that mode of treatment in UK, and hopefully it should come back in India as well, which is known as laser angioplasty. Again, there's a niche requirement for that, not for every patient, but that would be coming soon as well. It's very shocking to see that. In fact, we feel sad when we see patients in their 20s and 30s on a cath lab table. In fact, the other day I had to do an angioplasty on a 32-year-old boy. One of the artery was 100% blocked and another was 80% blocked. So it's very scary to see these patients on the cath lab table. And why is it so? Because of the lifestyle changes. Like when we were young, we were most of the time in the ground, playing sports and everything else. We had a more disciplined lifestyle. Now the lifestyle have changed. We are more, it's a redundance of more recreative lifestyle rather than any physical exertion. So what I would advise is, even before, whether you have a heart problem or you don't have a heart problem, you need to follow the 5 mantras as advised by American Heart Association. One is regularly follow up with your doctor, have a regular checkup annually. If you have a family history of heart problems, diabetes, or high blood pressure, you are at more risk of having this problem. So it's very important you keep a check on this, number one. Number two is have a proper diet. Reduce the cholesterol in your diet, reduce the salt in your diet, reduce the sugar content in your diet as well. So have a healthy diet. Third, maintain your weight. So maintain your BMI at around 25. So if you are obese, especially your obesity over the trunk, like obesity over the tummy, that is more risky rather than overall obesity. So very important you control your pouch as well. Fourth, regular exercise. In fact, it's the prescription that you should at least walk 30 minutes brisk walking every day, at least 5 times a week. Another, you need to have a proper sleep. In fact, there's a good scientific evidence if you sleep less than 6 hours, there's increased risk of having a heart attack as well. Right? And last but not the least, and very important, stop smoking. Because smoking is deleterious. Most of these young patients are having heart attack because of smoking. So you need to stop smoking. That's very important.